Imagine standing in a situation where fear should take over. Your heart should race, your body should panic, but nothing happens. No fear, no instinct to run. For a small number of people, this is not imagination, it's real, and doctors still struggle to explain it. Fear is not a weakness. It's one of the most powerful survival tools the human brain has. It warns us, it stops us, it keeps us alive. So when doctors discovered patients who didn't feel fear at all, they didn't call it a miracle. They called it dangerous. Because without fear, the brain can't recognize when life is at risk. Fear exists for one reason: survival. Long before modern medicine, fear helped humans stay alive. A sudden noise, a shadow in the dark, a sense that something isn't right. In milliseconds, the brain activates an ancient system called fight or flight. The heart beats faster, muscles tense, attention sharpens. Fear prepares the body to react before we have time to think. And at the center of this system is a small, almond-shaped structure in the brain, the amygdala. Everything scientists thought they knew about fear changed with one patient. In medical literature, she is known simply as SM. SM was born with a rare genetic condition that gradually destroyed both of her amygdalae. When doctors tested her response to fear, they were stunned. SM could hold snakes. She could touch spiders. She could walk through haunted houses without panic. Her heart rate barely changed. Her body showed no signs of fear. Brain scans confirmed it. The amygdala, the brain's fear center, was not functioning. Yet SM could think clearly. She could feel happiness, sadness, anger. Only fear was missing. At first, doctors believed SM was an exception, a once-in-a-lifetime case. But over time, other patients began to appear. Some were born with damaged or underdeveloped amygdalae. Others lost fear after brain injuries or neurological disease. Different lives, different stories, but the same result: a brain that stayed calm when it should have reacted. In dangerous situations, these patients didn't freeze. They didn't panic. They simply didn't feel afraid. What scientists were seeing was not a miracle. It was a pattern. To understand what's happening, scientists looked inside the brain. Normally, when danger appears, the amygdala reacts in milliseconds. It sends an alarm signal to the hypothalamus, activating the stress response. Adrenaline floods the bloodstream. Noradrenaline sharpens attention. Cortisol prepares the body to endure stress. Heart rate increases. Breathing becomes faster, muscles tense. This is the body's survival system. But in these patients, the alarm never goes off. Brain scans show little to no activity in the amygdala, even when they face real danger. The hypothalamus stays quiet. Stress hormones are barely released. The rest of the brain keeps working normally. Thinking, memory, emotions, intact. Only the fear response is silent. It's not bravery, it's neurology. At first, it might seem like a superpower. A life without fear sounds amazing. But in real life, fear acts as a brake. It slows us down. It forces the brain to evaluate risk. Without fear, the prefrontal cortex loses a critical signal. Decisions become impulsive. Danger feels distant. Doctors documented patients who repeatedly put themselves in life-threatening situations, not because they wanted to, but because their brain never warned them to stop. Fear is not weakness, it is protection. And when that protection is gone, even simple choices can become dangerous. Understanding fear is not just medical curiosity. It helps doctors treat anxiety disorders, post-traumatic stress, phobias, because too much fear can trap a person, but too little fear can expose them to danger. Modern neuroscience is not trying to erase fear. It's trying to restore balance, a brain that knows when to be afraid and when not to be. Fear doesn't exist to control us. It exists to guide us. When we understand fear, we stop seeing it as an enemy and begin to see it as one of the most intelligent systems the human body has ever built. Sometimes, fear is not what limits us, it's what keeps us alive. If this story made you see the human brain differently, there are many more medical mysteries waiting. Subscribe to the Medical Files. New stories every week.